Thank you, Jeanette, and thank you, Dr. Kogan, for having me on today again. Great to be here with everyone. I will talk today, as asked by Dr. Kogan, about some of the questions that we've been all having about the effectiveness of the the coronavirus vaccines, as well as the variants that I think we know have been coming up in the news. So first of all, we just want to kind of review that there has been obviously a huge worldwide and US toll. The cases are dropping in the US and DC, but I do think that we're not totally out of the woods yet, so to speak. And there's a lot of physical and mental impact on health from COVID-19 that is not even included in this. So just to take a minute and just reflect on these numbers here, I think there's just a staggering number of people that have died, people that have been affected by COVID. And so we want to really take this seriously. And I think we can maybe Dr. Kogan talk about this in the discussion, but how we're kind of dealing with this from a public health point of view. How do we look at, how can we basically get more public acceptance of the vaccine? I have some patients from Canada, and it's a totally different, viewpoint up there in terms of all of this. The vaccines that are available in the United States include, right now, both are 2 shots. One is the Pfizer vaccine, which is shown in phase 3 clinical trial data to be about 95% effective. And then the Moderna vaccine is also 2 shots and was 94.1% effective in the initial clinical trial data. There's about 30,000 people, I think, in those. The recent one, I didn't look today, so maybe they already did this. So please, if someone knows this, please talk about it. This is the single shot Johnson & Johnson, and I think today the FDA was supposed to consider it for Emergency Use Act. The clinical trial data on that was a 66% effectiveness, but they did also check, I'll talk about that later, but it does look like this could also be potentially relatively effective for the variants. So these are, I think, the more important studies that we can look at now in terms of how does the vaccine perform, not just in a clinical trial pre-release, but now in real world time, So in Israel, they actually have about 600,000 people that were matched in a one-to-one case control format. So there's 600,000 people that got the vaccine, and then 600,000 people didn't get the vaccine. They kind of did an analysis of, who got COVID, how serious was it? So this was published in the New England Journal of Medicine, which is one of the best, most prestigious medical journals, just a couple of days ago. And it concluded that the Pfizer COVID vaccine was 94% effective in a real world mass study of about 1.2 million people in Israel. So the conclusions were that the Pfizer vaccine was 46% effective at preventing infection 14 to 20 days after the first dose. It was 92% effective at preventing infection 7 days after the second dose. And then just getting 1 dose was actually relatively effective, 74% effective against getting hospitalized because of COVID, and 72% effective at preventing death from COVID. Vaccine effectiveness against illness that was having symptoms was about 57% after just 1 dose, and then 94% after the second dose. I know there's some thought among government officials here and others that maybe we should just give everyone 1 dose and then wait for more, and then give them the second dose later. So there is some, some evidence here that there is some partial protection even after 1 dose in this research. Now, during follow-up, only 1.8% of vaccinated patients developed COVID, but of the infected patients, most of them were, 57% were symptomatic. So, over half were symptomatic if they did get COVID, which wasn't a lot of people, but only 3%. I'm sorry? 3.7% required hospitalization, 2.2% had severe illness, and only 0.4% of those that were vaccinated, 0.4% of the 1.8%. Sorry, just to be clear, is a very tiny percent that actually died that had a vaccine. So the authors suggested, they concluded in this New England Journal article that the public health data suggests that Pfizer vaccine was also effective against the UK variant, which is one of the variants that's a little bit more contagious. The other big study that I'd like to highlight is the Mayo Clinic study. This just also came out, and it's actually still preprint really, but there's a link down there if you want to look at it. The Pfizer and Moderna vaccines were combined in a retrospective analysis, and they were found to be about 89% effective, so just below the 94, 95% that was in the phase 3 clinical trials, in about 62,000 individuals. So it's about 30,000 each in each group. The 30,000 group got the vaccine, the other group did not get the vaccine, in preventing COVID. This was actually a study of fairly high-risk individuals. There are people that work in healthcare, they work in the hospitals, they see patients, right? Healthcare workers, and also residents of long-term facilities, which we know are at high risk. But the vaccinated patients who were diagnosed with COVID were significantly less likely to be admitted to the hospital versus the control group. So it was statistically significant at 3.7% hospital admission versus 9.2%. So again, what their conclusion was in this study is that there's real-world effectiveness for reducing the rates of coronavirus infection, and also, but not only the rates of infection, but also the COVID-19 severity among a group of people, the healthcare workers and residents of long-term facilities that were considered at highest risk for infection in the population. So this is really important because if you look at the vaccine, there's a lot of, I think, at least if you look at the general population, there's definitely some hesitation, and certain, I think across the board, but I think, and definitely in different populations, there's hesitation. And so we know that in the real world, this does seem to be preventing severe infection, hospitalization. It is not clear yet in the trial data from what I can understand. Misha, you can correct me if I'm wrong, but I don't think we know for sure if it prevents transmission yet. But in theory, of course, if you're reducing viral load across the population, that would make the case number go down. So I'll move on to this and then we'll go into questions, but COVID VOCs, so these are called variants of concern. So viruses mutate very easily. Basically genetic material of viruses is very easily adaptable and changes to try to survive basically in the human body and animals, if they're animal viruses. So there's a couple of variants to just touch on here. And there's not a lot of data on this yet. So I just want to just say that they are studying whether or not these vaccines are effective against the variants. But the one that I think is closest to us in terms of geographically is actually called it's like a New York or Northeast one. Although I think I know in Maryland, for instance, where I am, we do have some of the variants already here from the other countries. But the B1526 is in the Northeast right now. This has a variant called the escape mutation, which is the E484K, that allows the coronavirus spike protein to bind to the human receptor where it attaches and it can replicate inside the cell. So it basically helps it stay on the human cell. So it makes it harder to kill off, basically. And it also has the mutation also reduces the neutralizing antibody response in the host. So it actually reduces our own immune response to the host. So again, it might make it harder in theory for it to get neutralized or killed. Other variants include California variant, a United Kingdom variant, Brazil variant, and South African variant. Some of these also have the escape mutation on it as well. So the variants in general, the idea of the variants is that they might be more transmissible across the population, might result in more severity of infection if someone gets it, and or more evasive in terms of the immune system's ability to neutralize the virus. However, the New England Journal of Medicine also reported a couple weeks ago now that reduction in antibody response, that there was a reduction in antibody response to the South African variant, but that experts believe this is not likely to significantly affect vaccine effectiveness. So even though there's less antibody response, it may still give us the same outcomes in terms of less hospitalizations, less deaths, etc. Okay, and then this is just a general comment that Dr. Fauci made yesterday, is that he is urging Americans to get vaccinated, regardless of the vaccine that is available at your local public health department, local hospital, GW, etc. So basically not to cherry pick the vaccine, if everyone, so this new potential vaccine J&J is less effective according to the trial data. It's 66% effective at preventing COVID infection versus Pfizer and Moderna, but in the study, it was just as effective as the other two at preventing hospitalizations and deaths, which I think is the main endpoints here. So the problem with waiting and trying to cherry pick is the longer people wait to get vaccinated, the more likely the virus variants have a chance to spread. So we know that this is happening in New York and California. Some of the variants are getting more, they're getting more and more dominant there. So again, it's a question of, it's almost like a race against time, trying to get people vaccinated and trying to convince people to get vaccinated. And then in theory, that will reduce the viral load across the population so that doesn't have time for the variants to become dominant. Pfizer and Moderna are testing booster shots against the viral variants that are offered to those that participated in the original clinical trial. So there are some boosters if they need it. We're not really sure if we're going to need that yet, but they're doing that just in case the variants reduce vaccine efficacy. So in conclusion, and then I think we can open up to questions and things and comments, is that, the overall considerations of COVID-19 is that vaccination will help to reduce circulating cases of coronavirus and to slow the spread of viral variants, which I think is just as important right now. The immune system response to vaccines, what has been studied, and most of the trials has been things like antibody responses, and that's what's the focus. But we know from the immune system that it's not just the antibodies that matter, but it's also the T cells and the memory cells, which may give us immunity for months to years. In fact, we know from a Singapore study for the first coronavirus back 20 years ago that a lot of people that had that natural infection of SARS-CoV-1 in Singapore still have immunity because of the T cells. So that's an interesting point. And so because vaccines typically have a stronger immune response than the natural infection, or at least the same level of response, at least that's the idea. In theory, that could confer immunity for months to years for us as well. Also, we know, since this is an integrative meeting, that boosting the immune defenses is always recommended with a healthy anti-inflammatory diet, eating the colors of the rainbow, as I like to say, getting enough sleep, managing the stress, walking out in nature, which I think we're going to do today with Sage, and then exercise, not smoking at all, limiting alcohol and sugar, and then ensuring adequate levels of vitamin D3. And then we do want to also continue with masks, social distancing, and hand washing, because again, there's that transmission question that vaccines may or may not prevent transmission. So you do want to still do that. And then I think I'll turn it back over to Dr. Kogan here.
Okay, great. Thank you so much, Dr. Wong. I think this is extremely important and timely information. I think there's been a lot of about VOCs, there's been a lot of fear. I think some of it is funded, some of it is unfunded. So I think this is a really good overview. And I think I'm not actually too fearful. I don't actually think that we're going to see any major changes due to the new strains anytime soon. But of course, we're going to track that. And I think it was expected. That's basically the long story short. So I have 4 significant questions from the week before, organized by Janet. So maybe what we should do is I'll start alternating them, and Dr. Wong and I can tag team and answer them. So I'll put the first one in the chat. And if it's your question, if you want to add anything, go for it. If you want to stay anonymous, that's fine. So I put the first question in there. It's a pretty good question. So, if you have already COVID and you've gotten the first dose, so basically you got a COVID after the first dose. First of all, I think it's extremely unlikely scenario, but let's say you have. The question is sort of when and if you should get the second dose. I don't think there's a really good answer. I do think that you should probably not get it on the same schedule as recommended. So I think you should probably wait for a month. There is some logic in saying that if you take the second vaccine too close to after the COVID, you may have a hyperreaction. I'm not actually sure that anybody practically answered this question. I think there's just too few of the situations like this to really say much. Andy, do you want to add anything to this?
I think no one knows. You're right, Misha. I think no one really knows the data on that. I've had patients ask me that myself in the clinic, and I think the visual recommendation is that you can still take it, but certainly there's that potential for that hyperimmune response. So you certainly wouldn't want to take it too close to getting COVID for sure. Like say someone had COVID and then, you know, still felt a little off, I wouldn't get the vaccine until they were totally recovered at least.
Mm-hmm. I don't want to answer the second part of this question. I would like to see the study before I can say anything, because it just doesn't make any sense. I would expect that any prior infection will boost antibodies, not decrease them. So one thing I want to caution everybody, when you're reading the studies, I was just reading really interesting information about, remember how we had all this surface spread scare? Well, it turned out the way they were doing this, I mean, there's a study that can be practical and study can be completely irrelevant to real life. So a lot of studies are done in the labs and they're totally irrelevant. So they looked at the surfaces, an original study saying virus can survive 28 days on the surface. Yeah, but the amount of the virus that was studied in that surface was something like 1 million times higher than an average droplet. So it's just completely impractical. Nobody ever going to see anything like this in the real life. So you have to be very careful. And is the study that they looked is purely theoretical to understand the viral process better, or is it actually practically can be applied to something? So who knows what those specific patients are? So I would love to, whoever wrote this question, shoot me a study link over the next week, and I'll take a look at this. And if it's something I feel is important, we'll bring it up. Okay, so let's take next question from the chat, and then we'll come back to the next question. So Kathy's bringing up this question, right? I think that's the only question I see so far. Outside of Judy correcting my posture on the board. Thank you, Judy, that's appreciated. I know I was too hunched over. It actually takes time to figure out how to balance the surfboard. In fact, you have to be completely upright. But it's not intuitive, for me it was. Right. My husband and I had our second shot 3 weeks ago. Congratulations. Is it now safe to eat indoors at restaurant? Is it okay to invite friends to our home for dinner who have also, okay, first is no, that's pretty clear. So, I mean, if you can try to find a restaurant where precautions are such that it's quite safe, meaning you have a single table outdoors, okay. Second, absolutely. In fact, that's probably now one of the best things that the vaccine have offering, that if you and your friends have been all vaccinating, live your life as we never had COVID, meaning you can meet together in any settings. At least that's the way that generally we can think. That's a great question. Thanks, Kathy. All right. And Andy, I'm sure you have something to add to that.
Yeah, I totally agree. I mean, I think once you get that, if you're not having symptoms, it sounds like you can live your life normally with other people who have also gotten vaccinated. Yeah.
Okay, so Sheila has a question that she wants to raise out. Sheila, give me a minute. Let me do the next question from the week before, and then we can have you speak out. Okay, so next question. I took an antihistamine before and after dose 1 to lower the chance of anaphylactic reaction, but at the hospital, the nurse cautioned against taking Tylenol or anything. Okay, so this is a massive miscommunication and confusion. Unfortunately, there are a lot of people who are not qualified to make such recommendations, making them. There's zero sense to make such a statement against Tylenol and Motrin. The reaction to antibody is not, to the shot, is a basically mostly histaminergic response. So if you took a Zyrtec and it was important because you have this totally fine, I have a very complex protocol, some that we've discussed before, that includes natural antihistamine, but I just personally don't like the antihistaminergic drugs because of certain side effects that can cause, like lethargy and especially for older population. But if you took it, that's fine. So I don't have these concerns. Standard recommendations for our staff at the hospital, everybody should have. They were basically saying pre-medicate every single staff member because they felt that we needed to go back to work. So everybody took Tylenol and Motrin, or either one or both together. So, Sheila, Andy, you want to
Well, I think I think they asked, would it lower the immune response to dose 2? What would you say to that?
No, I mean, I wouldn't worry
Yeah.
about it. If it's taken just for one dose, I wouldn't.
Yeah, I don't think it would either. Yeah, the immune response is stronger than that, so that should not matter.
Okay, quick, Sherry, why it's not okay to eat restaurant? Because other people are not vaccinated there. So you may have somebody who's sick, and the fact that you're vaccinated, remember, it's not 100% protection. So, you know, it's a risk modulation. So if you think that it's okay to go to a restaurant because the social precautions are there reasonable, but you can't often guarantee that. So since the way the question was asked, I'd say no if you can avoid it. Now, if you can't avoid it, you got to eat out. That's right.
Outdoors would be better than indoors. Yeah. But
sure.
I was driving by on my way home on my commute, and I saw a restaurant. There were literally like 100 people there. It was outside, and it's like, I don't know how safe that is because they weren't that close. I mean, they were pretty close to each other, I would say. So.
I mean, sure, your personal risk is lower after the vaccine, but again, you know, I think until more data is out, I think all the data so far is encouraging. The Israeli data that Dr. Wong just presented, I think, is very encouraging, but it's not yet a standard recommendation to.
I think also from a population point of view, just to repeat that if you do get it and you transmit it to someone else that doesn't have it, you don't know that you have it because and we know from previous studies that asymptomatic individuals can still transmit it. So then you think you're protected, you're vaccinated, you go out to the restaurant, you get the COVID virus, you could transmit to someone else. You wouldn't even know that you transmitted it.
Exactly. And so then tracking that down would be much harder now because you're most likely going to be asymptomatic and tracing is going to get more difficult. So yeah, that's actually a new spin on the situation that as more people vaccinated, tracing is going to become a little more difficult. But hopefully with more and more tests, that would not be as much of an issue. Okay, let me go back to, we only have a few minutes. I just want to mention that. So I'm gonna make sure we answer all the questions from the week before. Oops. All right, I meant to go to everybody. Okay. I can't remember what we were told in previous session about how best to mitigate side effects of the second COVID vaccine. I hate to ask you guys to repeat it, just more, that's fine. Okay, so we just covered a little bit about antihistamines. That's what I recommend. So I recommend a product, a specific product called Natural Dehist, simply because it's just one product. There are some similar products that contain N-acetylcysteine, they contain quercetin, bromelain, and vitamin C. If you really have a good response to medications like Zyrtec, I don't see any reason why you wouldn't take that for a particular reason, unless you really, for some reason, want to avoid it. But we also have a homeopathic protocol. I think that's a little too complicated to cover. Again, whoever typed this question, if you want that homeopathic protocol, just find me offline, okay? Because we only have a couple of minutes left. Okay, let's see. Here's the question. CDC listed corticosteroids injections weakening immune system as an underlying condition. What qualifies as that? How many? Yeah, that's a good question. So correct. Corticosteroids, prednisone and such, or methylprednisolone, Decadron. So all these medications are lowering immune system because just the nature of their impact. It's actually hard to say what would be considered safe. I would say that the joint injection is probably okay because it's not necessarily a systemic impact. But anything that, whether you take any systemic form of steroids, whether it's an injection or oral, would be considered definitely an immune suppression. And I think that's all I want to say about this, just because we're running out of time. Andy, anything to add?
No, I think that pretty much, you know, it is going to be something where, yeah, who gets it or not, you know, at that point. But I would say it would be, it certainly, you know, that would potentially affect the immune system for sure.
Okay, and the last question was, I don't think it was somebody asked about the dosing, and they were talking about CBD. I'm not sure this is relates to this sessions. So those person who asked that and said if it's a 300 milligram per day, that's a very high dose of CBD per day. I'm not sure. Send me a personal message because I don't quite understand what this was directed towards, because it definitely doesn't apply to this conversation here. And since this got brought up, some of you know I'm writing a book on cannabis, and there's really zero data to say that cannabinoids can somehow be effective in treating COVID. So there's a lot of hype out there. I've read several articles and people trying to sell CBD as treatment for COVID. That's complete nonsense. There may be some positive or some benefits because CBD is anti-inflammatory and THC has some antiviral properties, but we have to wait for studies to point out to any direction. That's about all we can say.
Okay, thank you, Dr. Kogan. I'm gonna step off here and
Thank
visit.
you,
Good to
Dr.
see
Wong.
everyone. Thank you.
Okay, last question. Well, there's more than one question, and we only have a minute. Does FDA have the approved Tafix nasal spray in this country? I have no idea what this is asking. Okay, is it the treatment spray? I'm sorry, Arit, I don't understand the question. Maybe you can. And also, did we skip?
Misha,
Yeah.
how about we just take
Stop.
those questions after Sage is finished with his forest bathing walk. Okay, good. So let's turn things over to Sage now.
Hello, everybody, and welcome, and thank you for being present here today. And I am currently at the National Arboretum at the Gotelli Dwarf and Slow-Growing Conifer Collection. And there we go. And I do have a mask on, so out here in public, but it is mandated here on the Arboretum, so hopefully you can hear me clearly. And just moments before we started, I think one of the folks here was blowing like an air blower. So if you hear that in the background, I hope it's not too loud. And if you don't, then awesome, that's great. So yes, welcome to forest bathing. And if we can first just get comfortable and relax for a moment, whether you're sitting, well, hopefully you're sitting. But yes, let's go ahead and get into the present moment and check in with ourselves here. And what we'll do is go ahead and either bring your focus to a soft gaze or go ahead and close your eyes, whichever will make you feel more comfortable. And what we're going to do now is take a nice, gentle, deep breath. Nice inhalation. Hold for a moment, and then when you're ready, go ahead and exhale. And again, nice, gentle, deep breath. Exhale when you are ready. We'll just do a body scan. Starting from our feet, we'll make our way upwards. So let's bring our focus and attention to our feet. Perhaps how they are positioned on the ground. Notice how the earth supports you. And even if you're in an apartment or an office or at home on the second floor, the earth is still supporting you. You'll be able to feel that and notice it. And again, nice, gentle, deep breath as we bring our focus up our legs towards our knees. And moving upward towards our pelvis. And noticing, observing, without judging, how our body rests on our pelvis. Perhaps if you're sitting, observing how your seat conforms towards your body. whether in the pelvis or on the back. And again, nice gentle deep breath. Holding for a moment and then exhaling when you're ready. Now bring our focus and awareness to our abdomen, torso. Observing how our body expands as we breathe. Noticing that we not only push out forward and backward, but also sideways as we inhale and fill our lungs and diaphragm. Now let's bring our observation and awareness to our shoulders. And how they carry the weight of our arms. And again, nice gentle deep breath. And as we exhale, how about we drop those shoulders? And from here on out, as we exhale, let's think about just relaxing those shoulders with each exhalation. Now bring on our awareness to our arms and our hands. Whether they're hanging down by our side, perhaps if they are propped up on our lap or on the legs. Again, nice gentle deep breath. Let's bring our focus and awareness back to the center, or in this case, the screen. And you just take a moment now to share, or what I would like to say, chatter share. And what we'll do is, in one word, if you could just put in the chat, but do not send just yet. Please do not send it just yet. Just put in, key in, type in one word to explain how you're feeling or what you're noticing right now within yourself. Again, just key in one word. Do not send yet. I will give you a countdown from 3, 2, 1. And then when I do say send, then you all send at once, creating this chatter fall. And I'll go ahead and read them off the screen as you folks just send them in. So I'll give you a moment to key in that one word. And then shortly, I will begin that countdown. And on 3, 2, 1, hit send. And oh, so much awareness, fever, quiet, symmetry. I love this, relax. And then here. Thank you everyone for sharing. So, oh, presence. Thank you. I'm surprised I was able to read the majority of that, but thank you all for sharing at that moment. Now, our next invitation, an invitation is just that, as if it were an invitation from social media or anywhere else. You could say, yes, I'm going to participate, or not, or just be indifferent. But either way, please enjoy what you see in the screen. And our observation, or rather, our prompt for this is just observing the different textures and colors that are before you. Now, what I'm going to do is just walk around the Gotelli section so that you all can see what lays around here at the National Arboretum. So let's bring our focus and attention back to center or back to the screen. And we can enjoy this view here from this little pagoda. And again, if we can go ahead and start off with a chatter fall, I'll give you a few moments. And again, wait for me to tell you to send, but not just yet. I'll give you a few moments. And again, just a word or two to jot down your observations. And so let's go ahead and start off with that countdown. 1, 3, 2, 1, and send. Anxious, serenity, beauty, symphony, visual symphony, clear, fresh air. So like peaceful, God. Peaceful again. So thank you, everybody. Thank you all for sharing. And now what we're going to do is we're going to have our tea ceremony. And let me just, bear with me, folks. Let me just turn this around. Here we go. So we're going to have our tea ceremony. And what our tea ceremony does is just kind of bring us back together and bring us back before we get back into that real, quote unquote, that real world that's out there. Hopefully this will be a smooth transition from getting into this relaxed, peaceful, serene state towards getting back to, like I said, the real world. And what I have today, our tea is something that I made at home. And it's just a simple ginger tea. And I do have these 3 cups here. Just pick this up. And I have 3 cups for us today. 1 for each of you that has joined us today. The other for myself. And lastly, this 3rd cup is for our host. And our host being not myself, for I'm just the guide, but our host is the National Arboretum, the land that is here. And before the folks here at the Arboretum, we, the stewards of the land, the ancestral stewards of the land, were the Piscataway, the Anacostia tribes here in Maryland. So with that, I'd like to honor them and acknowledge the land that they have shared with us. And hopefully the Arboretum can continue their work so that others, our future generations, may join us in this. So with that, I'd like to share this and pour that into the ground for them. And before we move on, I have those teas for each of us. I would just like to finish off with a bit of drumming, a little bit of sound therapy, if you will. So hopefully you'll be able to hear this well enough. And just go ahead and do this for a few minutes. So you can sit back and relax yet again. thank you. Each and every one of you have joined us today and for being here and being present for this walk.
Thank you.
Thank you. And actually, if you'd like to share anything once more, we can have another chatter share before I turn it over back to the doctors. So thank you, Sage. Thank you very much. That was a beautiful walk. Alrighty. Namaste. Thank you, Richard. And Funman. And namaste. Love the job.
I don't know. I don't want to answer any questions after this. And I don't know if there's anything that pressing there. There's a lot of words. Thank you, everybody.
Thank you. You're welcome.
Quiet, peace, temp, space, calm. Peace.
Thank you, Rick. Thank you, Rick. So I'll go ahead and turn it over to Dr. Mika. Thank you.
All right, I think we should call it a day. A little early. I know there's some unanswered questions, but those of you who ask them, bring them up next time.